Hello guys, welcome back to my channel and welcome back to another video guys. Today we are blessed to have a doctor on this channel and he's going to take us through some of the conditions in pregnancy, and we are looking at pregnancy induced hypertension for today. So hey, subscribe to this channel and be part of this beautiful family. Also hit the notification bell so anytime I upload a video you'll be the first to get it. Also like, share, comment down below at the comment section. So without wasting much time, help me welcome Dr. Awuah on this channel today. Doc, you are warmly welcome to this channel.
Thank you very much.
Fam, he doesn't like this one, so me, I am using it for him. So today I am Dr. Awuah today. Alright, a lot of women are being diagnosed of this pregnancy induced hypertension, and this is hypertension that women acquire during pregnancy and adult one. So we want the doctor to take us there, because some will even say that when they diagnosed of this pregnancy-induced hypertension and a lot of stuff, and a lot of people also have some perceptions and a whole lot of stuff about it. So Doc is going to take us through, then we know everything about it, how to go about it if you are pregnant, and then you get this pregnancy-induced hypertension. So quickly, when we say pregnancy-induced hypertension, please, what is it?
Okay, before that we have a general term or an umbrella under which the pregnancy-induced hypertension falls under, which is hypertension in pregnancy. And with that we have several times, so like you said, we're going to pick up on pregnancy-induced hypertension. So essentially, when we say pregnancy-induced hypertension, it's having blood pressure of systolic 140 millimeters of mercury and diastolic 90 millimeters of mercury.
Fam, please, the systolic is the top one when you check, and the diastolic is the down one, please. So don't get confused. You don't worry. All his steps, you break it down so you understand. Okay?
Yeah. So if you have any of these or more in a woman who was previously not having any BP, when you realize this, especially after 20 weeks of pregnancy, you say the woman has pregnancy-induced hypertension. So.
Right, so thanks so much, Doc. Alright, so the next question for Doc, we would like to know some of the risk factors of this pregnancy-induced hypertension. So Doc, what are some of the risks that are involved with this PIH?
Okay, so with PIH, there are several risk factors involved, but we're going to mention just a few, not to bore your audience. So essentially, having had this hypertension before, the pregnancy-induced hypertension, if you've been pregnant more than once, and your previous pregnancies you had PIH, you had a risk of having PIH in a current pregnancy. And also being hypertensive before pregnancy is also part, although that one is classified differently, what we call pre-gestational hypertension. Also being a first-time mother or pregnant woman, that also increases your risk of developing pregnancy-induced hypertension. Also being obese or having a BMI of more than 35 also predisposes you to having pregnancy-induced hypertension. So these are some of the few risk factors that we can say puts a person at risk of having PIH.
Alright, so thank you, Joe. So we would like to also know some of the signs and then symptoms of this PIH. Please, the PIH is pregnancy-induced hypertension, so please don't get lost, okay?
Okay, so with the symptoms and signs of pregnancy-induced hypertension, essentially you have the higher BP. Okay, so when you begin to have signs, especially what we would term as end organ damage, I don't know if it's too heavy for your audience.
It's too heavy for me.
End organ damage. So you have severe headaches, you feel nauseous, you vomit, you're dizzy, you have what do you call it? Epigastric pain. So around here, just below.
Yeah, example, can I tell you that now come here.
Exactly. If you have pain there, that puts you at risk. Some people too are losing a lot of protein, so sometimes you see that some women have very big swollen feet.
Yeah. If you see this swollen feet and stuff, don't say you are pregnant with twins or you are pregnant with male child. Please. Pregnancy-induced hypertension can cause that. So don't stay in the house and say, Abia, you are pregnant with a male child or twins. Kindly visit the facility so we take care of you, okay?
Yeah.
All right.
Yeah, so others too could have visual disturbances. They could have blurred vision.
Wow.
In the very severe ones, you have blurred vision. So these are things that people usually notice, but some will say, oh, it's nothing, I'm fine, especially with the headaches. Rarely you have men having these visual disturbances and all these epigastric pain. Paramount amongst them is the headache. Most women have the headache and they will just say, oh, it is the pregnancy which is stressing me out. But little will they know that they are having pregnancy-induced hypertension or PIH.
Alright, thanks so much, Joe. Alright, Doc, so we would like to also know some of the complications of this pregnancy-induced hypertension.
Okay, so complications that can arise from this pregnancy-induced hypertension or PIH, most common is what we call eclampsia.
Okay.
So eclampsia is essentially having seizures because of the high BP in a pregnant woman. That's what we term as eclampsia. So when the PIH is not well managed, even sometimes when it's even managed, women are at risk of having this eclampsia, and it's very, very dangerous because it increases the incidence of the maternal mortality and morbidity, and also increases the incidence of perinatal mortality and morbidity. And also the PIH could also lead to what we call intrauterine growth restriction, where the woman's baby is not growing as it should.
Okay.
So you give birth and they say it's a very small baby.
Okay, so with that you can even get to the full term,
Yes.
but still the baby will be low birth weight.
Exactly.
Okay.
Exactly. And low birth weight babies have a lot of challenges, and that contributes to perinatal mortality and morbidity. You could also be at risk of what we call placental abruptio, where the placenta separates prematurely before the third stage of labor, where after the delivery of the baby, the placenta has to come out. If this happens before, we call that placental abruptio, and if it's early in the pregnancy, it could be very detrimental to the baby's survival, the fetus survival. So these are some of the complications that arise from having.
Right. So thanks so much, John. You are really doing well. You are really helping us today on this topic. The next thing is that how do we manage this PIH? Is it manageable or nothing can be done about it?
The PIH is manageable.
Okay.
I mean, it's not treatable in the sense that you give medications and the blood pressure goes away, but it can be well managed. Time and time again, people think that once they're on medication, the hypertension is gone, but it's rather the medication that's helping keep the BP under control. So if you do not follow your doctor or midwife's instructions or advice, you are at risk of getting things out of hand. So yes, PIH is manageable. Usually, we advise that women start pre-conception counseling, especially those who have underlying conditions, renal disease, heart disease, hypertension and all that, diabetes. You start pre-conception counseling where you see a doctor or a qualified health professional who will take you through what you have to do, whether you can get pregnant or not. And if you get pregnant, what are the things that you should do even before the pregnancy itself starts. Then once you are pregnant, or once you notice that you may be pregnant, you quickly report to a health facility where the pregnancy is confirmed and your other tests are run to make sure that you are healthy. And we advise that most women who would come for their antenatal visits as they should. You come for antenatal, your midwife sees you and gives you your next visit. Usually with those who have pregnancy-induced hypertension, their visits are more because they are at high risk because of the complications that we mentioned earlier.
Okay.
So we advise that they come as they should, and they also stick to the medications that have been given to them, because in time we realize that most women are not taking their medications as they should, and they now are rushed in as emergencies, and now everybody has to be moving up and down, and if care is not taken, if you're unfortunate, you may lose both mother and baby, which we do not desire. So it's very important that we keep to these things that I've said.
Alright. So thanks so much, Chuck, for taking us through this. So with this, if the woman has delivered, like after delivery, should the woman still continue with the BP medication when it comes to this PIH?
Okay. So what we said was the pregnancy brought the BP.
Yeah.
So once you've delivered, the hope and expectation is that the BPs go down.
Okay.
Usually it takes some time before. For some people, they are lucky and the BPs go down earlier as they delivered. But for most people, they still have the high BPs. So you continue taking the medications. Your doctor will see you. You come for reviews. Usually we ask them to check the BPs, BP profile.
Yeah.
You check the BPs home, then you bring it while you're on the medication. Then gradually you are weaned off the antihypertensives because the BP was because of the pregnancy. In the person who didn't have the high BP before pregnancy and before that time. So they keep taking the medications till they are asked to stop.
Okay. So you don't have to stop on your own. Please. I had one client, I was so close to her. Anytime she has issues, she used to call me and stuff. So I think she was on this BP medication, but she stopped herself without telling anybody about it, and then she lost it. So now the lady is no more, and she has left her baby with her mom. You can imagine. So please, my dear pastors, stop discouraging your members about this BP stuff. Somebody will say that mesofo abriki. So they will be having the medication, but they won't even take. Please, this is a very serious thing. BP can kill easily. So please, if you are on the medication, just be taking it till a doctor tells you that you are okay, you are good to go before you stop. Don't just stop it and say that we're jai because also for break. I'm so for break. So please, this is my little advice for you. Alright, Doc, so is there any advice that you would like my viewers to know about it? Just anything, overview of this pregnancy-induced hypertension.
Okay, so I think we've said it all, and the advice that I'll give, we mentioned it just not long ago. We advise that most people would enroll in pre-conception counseling, where they are assessed and any challenges that could be encountered in getting pregnant and throughout pregnancy are addressed initially. And once the woman is pregnant too, she also comes early to the hospital to confirm the pregnancy, and routine tests are done for them. If she is found out to have BP, even at the early stages, we know how to manage her. And all the times that you've been asked to come to the antenatal clinic, please make sure you come. You do not wait for your husband. You do not give the excuse that you do not have money. That's why, because that's why the insurance exists. There are a lot of things that the insurance covers for these pregnant women. So even without money, you should still come, and we take it from there.
Okay. All right, guys. So help me thank Dr. Awuah so much today for doing this video for me. For doing this for me. It's not everyone that will even like to do this stuff. Guys, me, I don't have money to even, I've not even bought him water. I was doing this for Alright, so guys, help me thank him so much. God richly bless you for this that you've done for us. Alright guys, so we end here for today's video. If you have any question for Dr. Awuah, you just leave it down below at the description. I'll forward everything to you so you will answer for us. So you don't worry, he's even part on the channel. So any message or anything from the other comment section, we will answer them all for you guys. So if you haven't subscribed yet, guys, what are you waiting for? Kindly subscribe to this channel and be part of this beautiful family. Also like, share, comment down below at the comment section. See you again in our next video, and it's bye bye.